Good morning, everybody. That's during the following minutes, I will try to put in just this presentation one series of things that for sure you know very well. But I will try to be a little bit provocative in some of the comments and questions. Of course, that the healthcare burden in Europe is really, really relevant, and it is expected that will increase much more in the following years. For sure that this is an elephant in the room in Europe, because the cost is, the problem is there. Sometimes nobody knows how to tackle this, and for the reason that we need to consider what can be done and what can be done in the field of big data, real-world data, and artificial intelligence in order to try to take and curb a little bit these elephants that we have in the room. If we see the data from Europe, this is the percent of the GDP in each country that is expended in health. If you see the average in Europe, this is around 9.6, and this is all the EU members, and these are the associated countries. As you will see, there are huge differences, but the average is practically 10%. 10% of GDP right now is just the cost of health in Europe. But how the GDP of the countries change, what happened in between 2008, 2013, there are some countries in which fall dramatically due to the economical crisis. And well, this was the past. That what is interested is what can be done, what can be happen in the future. And then you will see here what is the expected increment in healthcare, this in gray, but here there is another that is much more important, that this is the long term, that is related with the dependency, the frailty, and what is happening with the elderly population. And this is the expected, is much higher, that is expected the increment in healthcare itself. But if we put together the impact in the GDP is really, really relevant and can be affordable for many countries in the future. What are the causes? The causes, for sure, one of the most important is demographic changes. Demographic and what this drives to us, that this is the chronic diseases. There are some other, that this is the cost of technology. Well, there are discussions about if the normal cost of disease will be important or not. This is that the cost will be increased even that is low productive. But, well, in health, this is a little bit discussed, but in some countries this happens clearly. And of course, depends on the country income, the disponibility that they can spend in health care. But look at a little bit demographics. This is right now what is the life expectancy in the European countries. If you move from less than 76 until more than 84, according that we increase the colors. You see many areas of Europe and then even in Spain that the life expectancy is really, really high. And this is expected that change the shape of the population right now, and it is expected that progressively change. And there are a concentration of people with more than 60 years old. And this drive what I'm going to see, chronic diseases and the impact of the chronic diseases in burden. I showed yesterday this slide too. This is just to reflect that the oldest the people, the most frequent, the multimorbidity at the same time. But there is another very important thing that is underlying this, that this is the intrinsic capacity of the subjects. Intrinsic capacity of the subject is decreasing according increases the age. And this intrinsic capacity is the combination of many aspects. Multimorbidity is one of them. But of course, we need to consider age, sex, wealth, education, and what are the capacities, locomotor capacities, cognitive, and so on. Then this is what we need to tackle many times if we want to face the problem more in the future. And this is the concept, a concept that became earlier than frailty or dependency, but this is the final way of this losing this intrinsic capacity arrive to the dependency and then. And this is one picture that indicated the necessity to integrate all of this information. And for this, for sure, that big data, real-world data, are absolutely necessary and can give us ways to try to prevent and also how to tackle better. What we can do in front of this big problem? The first is to redefine care models. In the last years, for chronic diseases, non-communicable chronic diseases, has been established different kind of care models put in place. Chronic care models, improving chronic disease care, innovative care for chronic conditions, Stanford model, community-based, all of them are based on reorganization of care delivery or patient-oriented education of self-management. But at the end, if you see here, all these models tackle in specific areas of specific diseases. We need to change our mind, and we will move to patient-centered healthcare models. And for this, as we'll comment later, big data, real-world data, and artificial intelligence will be a very, very nice and important tool. The second one is when we need to optimize resources. These are data from states, but we can translate here. These are billions of dollars. Billions of dollars that are lost due to overtreatments, failure of care delivery, or lack of care coordination. Of course, that we need to try to do our best, eliminated care that cannot help to the patients, and restrict treatments and intervention to patients that will be benefit, based in the individual assessment. Of course, we need also to tackle in failures of care delivery with continuous studying the care, identify what works for whom and in what context, and scaling best practices, including preventive care and early wasting. And for sure, that also ensuring that the higher risk of cosmetic is used, is identified, is used. But then we can use that big data and artificial intelligence introducing workflow optimizations. We can also adopt technology for gathering actionable data to mitigate risk and improve patient experiences, interoperability, and linking healthcare policies with evidence-based procedures, and of course, tackle in some areas, mainly therapeutic, in personalized medicine. Personalized medicine, of course, that usually we are speaking about personalized medicine in treatments. But there is another thing that we can do in that this is predictive analytics in healthcare trends. This predictive analytics and healthcare trends can give us information about what is going to happen in the following weeks, months, years, and then to try to avoid or to be prepared to face with this kind of problem. And of course, this brings to us that we need to promote health and to prevent diseases. Altogether, that can be an important aspect in order to try to curb the cost, the increment of the cost. And then we have the possibility of leapfrogging with big data and artificial intelligence that are very interesting tools for better understanding, planning, and delivering health care prevention, care, and research. But in the core of this big data, for sure, in the core of big data is the electronic health recordings. Electronic health recordings, that is the base to when we collect the large amount of information that we need to try to work with them. And this is one recent study that analyzed this. You will see here these stages. Stages means how the developed is the electronic health recording capacities, according to the more simple one, only storage, to those that with analytical, providing analytics in real time. And then you will see how it is expected. We are right now here, but what is expected in the future that go incremented from time to time. And this is relevant in terms that consider that in the future, this green line hopefully will rise more rapidly than expected initially. Well, one example of one of these, the structure of this electronic health record. This is our electronic health record. We have data from primary care. We have data from the hospital. We have data from general system in which I have demographics and some other data. Data for public health and some others. And this is integrated, and then we can use for that manage in terms of evaluated how the resources are running, and also to use as for research. Then these electronic health recordings, of course, are very useful for health authority stakeholders, are of course that useful for care providers, physicians, nurses, but also will be the element for patient-guided services to the patients and the caregivers of the patients, and then for sure to use as a research in order to improve. One, of course, in this, how can today manage in a more simple way, but is really, really effective. We can use in management data and surveillance, situation, awareness, priority settings, that what are that I try to use in risk stratification and prevention-driven, allowing the proactive preventions, because as I show you how the information is released and is in our healthcare model. It is also to assess the efficacy, if it's efficient or not, and also that can be used for comparative studies in between the different areas. Just one example. This is from the practically 5 million people of our community, Valencian community. These are the 9 groups of the clinical risk groups. And then you will see the severity in each of the levels, what is the severity, and here you will see what is the age, the average age, the population. But then what you will see here, for example, is the cost in drugs for each of the level, and also for each of the level also of severity. Then, for sure, that electronic health recordings are in the core of big data in health, because will be the basic one. But these electronic health recordings can be also fitted with omics, all kind of omics, from time to time, more and more. Also, they can fit with images, and also can fit about what is the social situation, and also factors related with environment. Today, we have a poor environment here due to the fighting in the fields. But well, that is really important for the future, as I showed yesterday, the impact of the pollution, not only in respiratory diseases, but also in cardiovascular diseases and overall in mortality. Well, and a step further, for sure, And a step further is artificial intelligence. That is with to compute the data, to analyze, to learn from the data using machine learning or more sophisticated deep learning and neural networks. And what will be more important for the future, that this is to do systems that will be deductive by themselves and inductive reasoning. This is coming recently, and to introduce in health. What is true is that in health, we are lagging behind other fields in the development of artificial intelligence. Maybe these come from several of the problems that we will see. But what are today, in which fields of health are used artificial intelligence? In diagnostic, for sure, clinical and genetics and analyzing images. Yesterday we had here very interesting examples of that. Also in robot-assisted surgery, that this is rapidly implementing in many, many hospitals. Also act as a virtual nursing assistants. And this is also linked with patient engagement. To use all of these data tools that we have in our hands in order to try to improve progressively in all of these and gaining in saving cost and also increasing the capacity and increasing the success in the future. And also, of course, for an administrative workflow, it is a real interesting tool and very useful for administration. But we have the hurdles. Hurdles are in several aspects, but I just focus in 4. The first is cultural, the way of thinking. We need to consider that the training of the doctors and nurses and people that are working in healthcare have one idea, that's medicine based in results, in previous studies, and to perform a hypothesis and try to tackle in this hypothesis, but in artificial intelligence is absolutely opposite. Not always is well accepted. It's not always well understanding and accepted. The second one of the real problems, in order to put together all the information, is the data structure. Data normalization, that is one of the most important problems. And if we speak only about that aggregated data, or we are speaking about that codified data, will be easier. Even in this, there are a lot of problems, but when we start to move to natural language, the problems even increases much more. But this is very important. And technologically, well, the development is rapid, but in health, the main problem is to have real-time processing and analysis of the data. We can store a lot of information, and we try to tackle and analyze in them. But of course, that works in real time, in global, not in specific aspects, is quite difficult and need to be developed more in the future. And of course, legal. I don't want to say anything about legal. This afternoon there is a session, those that have interest. But the introduction of the GDPR and all derived regulation in the different countries, even that initially is expected that help the area of research, not always is very well applied, and then frequently produce more problems that not facilitated the development of research. Just a few data from Accenture. Accenture estimated that the top 10 application of artificial intelligence in healthcare could save the industry more than 150 billions of euros annually in 2026. And the market is growing 40% every year. It is expected that in 2021 will be around 6.6 billions of dollars, the market of artificial intelligence in health. Then we have in front of us, it is increasing. Of course, that a better organization of this will take advantages. Well, and what about the EU Commission in this? Yesterday, the officer that came from the EU showed this slide. These were recommendations for the Commission communication in April last year in order that improve digital services for citizen empowerment, connect and share health data are those that will be done in the following years, and also to facilitate better access to their health data. I can say that here in the Valencian community, today the patients can arrive, can take the information in his own records, that with control by that internet and with, of course, some passwords in order to provide the protection of the data. But what about the calls that are launched by the EU? We have several calls that tackle in this artificial intelligence and big data, in personalized medicine, in innovative health and care systems and integration care, in contribution in digital transformation in health and care, different ones. Also, in this, following with this digital transformation, in trusted digital solution and cybersecurity, and also in digitizing and transforming European industry and services in support hubs and support platforms and pilots. This is what is in some way the signal that the European Commission is really engaged and really interested in that in Europe this can grow and can be used more effectively in that. And my final slide is this one. This is a meeting for next week. Why I bring this information here? Just because if you look here, is all the most important health organization in the world, regulatory agencies, academy, industry. And it's all the meeting during 3 days that this is health-oriented in all the aspects, some of them that I have commented today, but many more that will be appears in the following years. Thank you very much for your attention.